Multiple sclerosis is a disabling disease of the brain and spinal cord. Hello, everyone. This is Arlene Jameson. I'll be talking about the pathophysiology of multiple sclerosis. Although etiology is unknown, there are risk factors that may increase the risk of developing multiple sclerosis. Number one is age. This affects people somewhere between the age of 16 and 55. Sex. Women are more than 2 to 3 times as likely as men to have relapsing and remitting multiple sclerosis. Family history. Race. White people, particularly those of Northern European descent, are at highest risk of developing MS. People of Asian, African, or Native American descent have the lower risk. Climate. MS is far more common in countries with temperate climates, including Canada, the northern United States, New Zealand, southeastern Australia, and Europe. Vitamin D. Having low levels of vitamin D and low exposure to sunlight is associated with greater risk of MS. Smoking. Smokers who experience an initial event of symptoms that may signal MS are more likely than non-smokers to develop a second event that confirms MS. Other proposed causes includes autoimmune theories. The search for an autoantigen has taken a long time, but at least there is one reported. It is the enzyme GDPL fructose synthase. Another one is the human endogenous retroviruses have been reported in MS for several years. Recent research as of 2019 point to human endogenous retroviruses. Specifically, one of the protein of the viral capsid has been found to activate microglia in vitro. Activated microglia in turn produces demyelination. Some interactions between the Epstein-Barr virus and the herbs could be the trigger to the MS microglia reaction. Other causes include CSF composition and genetic cause. MS patients have been found to have a special genetic variant named rapidly progressive multiple sclerosis, which would behave differently from where it is explained. It is due to the mutation inside a gene NR1H3, an arginine to glutamine mutation in the position of PARG415GLN in an area that codefines the protein LXRA. And primary neurodegeneration theories. Others propose an oligodendrocyte stress as primary dysfunction, which activates microglia, creating the normal appearing white matter areas. Another propose a yet unknown intrinsic CNS triggers induces the microglial activation and clustering, which they point out could be again axonal injury or oligodendrocyte stress. How are MS lesions developed? MS lesions developed inside a normal appearing white matter. The most accepted sequence of events is first appears in normal appearing white matter, and then the so-called preactive lesions, which activated microglia, and finally the BBB breakdown, the blood-brain barrier disruption, which enables the entry of T cells to the CNS. This marks the beginning of an autoimmune attack, which destroys myelin in active lesions. When the attack is resolved, a characteristic clear scar is formed by astrocytes. It is hypothesized that the problem in CNS cells produces an immune response that destroys myelin and subsequently breaks the blood-brain barrier in external factors producing the leak enters the CNS and destroys the myelin and axons. Whatever the underlying condition for MS, it appears that the damage is triggered by an unknown soluble factor in the CSF, potentially produced in the meningeal areas. This factor can diffuse into a cortical parenchyma and destroy myelin, and either directly or indirectly through microglia activation. As a result, MS lesions are formed, as driven mainly by T cells. It has been found recently that B cells are also involved.